Hello everyone, welcome to Healthy Care. Did you know that your body often whispers before it screams? When it comes to cancer, those whispers can be the difference between life and death. While many think of cancer as something that announces itself with glaring symptoms, the truth is much more subtle and far more dangerous. Some of the earliest warning signs are so small, they're easy to miss. Yet catching them early could give you a survival rate of over 90%. Wait too long, and that number could drop to less than 20%. In today's video, we're uncovering 8 surprising early warning signs of cancer that could save your life. These aren't the symptoms you've heard about 100 times before. Instead, they're the quiet, unexpected signals your body sends before a serious problem arises. Maybe you've ignored persistent aches, dismissed unusual rashes, or chalked up night sweats to stress. But what if these small signs were your body's way of alerting you to something much bigger? This isn't about creating fear, it's about empowering you with science-backed knowledge that could truly change your life. Let's uncover the secrets to early detection and help you live a longer, healthier life. Number 8. Eye pain. When you think of cancer warning signs, eye pain probably isn't the first thing that comes to mind. But persistent eye pain or other unusual symptoms could signal a rare type of cancer called ocular melanoma. This type of cancer develops in the cells that produce pigment in your eye. While it's uncommon, catching it early is critical. So what should you look out for? One red flag is blurred vision that doesn't get better, even with new glasses. Another is unexplained flashes of light, similar to what people experience with migraines or retinal issues. Perhaps the most noticeable, but often ignored, sign is a dark spot on the iris. If this spot grows, changes shape or changes color, it's time to act. Certain factors can increase your risk, like having fair skin, light-colored eyes, or spending a lot of time in the sun without proper eye protection. The good news? Regular eye exams can detect these changes early, sometimes even before symptoms appear. If you've noticed persistent eye pain or any of these symptoms, don't hesitate to consult an ophthalmologist. Even if it's not cancer, conditions like retinal detachment or glaucoma are serious and require immediate attention. Remember, your eyes are a window to your overall health. Don't overlook what they might be trying to tell you. Number 7. Fingernail marks. When was the last time you really looked at your fingernails? Changes in your nails might seem minor, but they can sometimes reveal something far more serious. Like subungual melanoma, a rare form of skin cancer that develops under the nail. One of the most common warning signs is a dark vertical streak running underneath the nail. While it might look harmless or resemble a bruise, especially if you've recently bumped your hand, this mark doesn't fade or grow out with the nail. Another sign is what's known as Hutchinson's sign, where the pigmentation extends beyond the nail bed onto the surrounding skin. These changes can be easy to overlook or mistake for something else, like a fungal infection or simple nail trauma. Here's the difference: a streak caused by melanoma often appears suddenly, evolves over time, and doesn't behave like a typical bruise or infection. What should you do? If you notice any unusual changes in your nails, like a streak that wasn't there before, or one that seems to grow darker or larger, don't ignore it. Consult a dermatologist. Early detection is critical with subungual melanoma, as it can spread quickly if left untreated. What might seem like a small detail could be a life-saving observation. Number 6. Persistent fever. A fever usually signals that your body is fighting off an infection. But what if it lingers or keeps coming back for no clear reason? A persistent fever, especially one that recurs or doesn't seem linked to an infection, could be a warning sign of blood cancers like leukemia or lymphoma. What makes these fevers stand out? They're often cyclical, meaning they come and go, and they may not respond to typical treatments like antibiotics. They're also frequently accompanied by other symptoms like night sweats, unexplained weight loss, and fatigue. In blood cancers, the immune system is compromised, and the body's fight against abnormal cancer cells can trigger a fever. It's essentially your body sounding the alarm that something isn't right. What should you do? If a fever lasts longer than 2 weeks or keeps recurring without a clear cause, it's important to consult a doctor. Even if it's not cancer, persistent fevers can signal other serious conditions that need attention. Your body knows when something is wrong, it's up to you to listen. Don't dismiss a persistent fever as just a bug. Early detection could not only identify the root cause, but also potentially save your life. Number 5. Body rash. Most of us think of rashes as annoying but harmless, a reaction to something we ate, touched, or wore. But did you know that certain types of rashes could point to something much more serious, like leukemia? One key sign to watch for is a type of rash called petechiae. These are tiny red or purple spots that appear on your skin and don't fade or lighten when you press on them. Unlike a typical rash, petechiae are caused by low platelet levels in your blood, which can lead to tiny blood vessels leaking under your skin. If you notice these spots, especially if they're accompanied by unexplained bruising or bleeding, it's a good idea to take them seriously. Leukemia affects your body's ability to produce healthy blood cells, and these symptoms are your body's way of signaling that something isn't right. What should you do? If the rash persists or you're experiencing additional symptoms like fatigue, frequent infections, or excessive bleeding, it's time to see a doctor. Even if it's not leukemia, unexplained rashes or bruising always warrant a closer look. Catching these subtle signs early can make a world of difference. Your skin can tell you a lot about your internal health. It's up to us to pay attention. Early action could lead to early diagnosis and better outcomes. Number 4. Persistent bone pain. Let's talk about something many people brush off: persistent bone pain. We all experience aches and pains from time to time, but this is different. If you're dealing with a deep, penetrating ache in your bones that seems to get worse over time, especially at night, it could be a red flag. Bone pain that doesn't respond to typical painkillers or feels like it's in the bone itself rather than the surrounding muscles or joints should never be ignored. In some cases, this can be caused by cancer that has spread to the bones or even cancer originating in the bones, such as osteosarcoma. What's particularly concerning is when the pain is accompanied by swelling, unexplained fractures, or other unusual symptoms. These are not things to chalk up to aging or minor injuries. What should you do? If the pain is persistent, worsening, or comes with swelling or other symptoms, it's time to see a doctor. Don't wait for it to go away on its own. Early detection is key, and even if it turns out to be nothing serious, ruling out cancer can give you peace of mind. Number 3. Jaundice. Have you ever noticed a yellowish tint to someone's skin or the whites of their eyes? This condition, called jaundice, isn't just a cosmetic issue, it's often a sign that something serious is happening inside the body. Jaundice occurs when there's a buildup of bilirubin, a substance produced when red blood cells break down. Normally the liver processes bilirubin, but if there's a blockage in the bile ducts, often caused by pancreatic or liver cancer, it starts to accumulate, leading to the yellowing of the skin and eyes. Jaundice rarely comes alone. Other symptoms to watch for include dark urine, light-colored stools, and upper abdominal pain. These are signs that the body isn't processing waste properly, and they need immediate attention. It's important to remember that jaundice doesn't always indicate cancer. It could be caused by gallstones, hepatitis, or another condition. But if it appears suddenly and without an obvious explanation, it's critical to see a doctor right away. Ignoring jaundice could delay a potentially life-saving diagnosis. Pancreatic and liver cancers are often diagnosed late, but catching them early through symptoms like jaundice could improve treatment outcomes. Number 2, unexplained night sweats. We all sweat at night from time to time, but persistent, soaking night sweats, the kind that leave your sheets drenched and force you to change clothes, could be more than just an uncomfortable nuisance. They might be a sign of lymphoma, a type of cancer that affects the lymphatic system. These night sweats often don't come alone. They're frequently accompanied by fever, unexplained weight loss, and overwhelming fatigue, collectively known as B symptoms in medical terms. What causes them? It's your body's immune response to cancer cells, which disrupts your internal thermostat and triggers these intense sweating episodes. The key difference between harmless night sweats and those that warrant concern is their frequency and severity. If you find yourself waking up drenched night after night, especially if other symptoms like fever or weight loss are present, it's time to pay attention. What should you do? Don't brush it off as stress or a warm bedroom. Persistent and severe night sweats should always prompt a visit to your doctor. Even if cancer isn't the cause, other conditions like infections or hormonal imbalances could be at play, and catching them early is always beneficial. Number 1, persistent heartburn. Heartburn is something many people deal with, often chalking it up to spicy food or a heavy meal. But when heartburn becomes persistent, lasting weeks or even months, it could signal something more serious, like esophageal cancer. Here's how it happens. Chronic acid reflux can damage the lining of the esophagus over time, a condition known as Barrett's esophagus, which increases the risk of cancer. While occasional heartburn is common, long-term reflux that doesn't improve with medication or lifestyle changes should never be ignored. There are also warning signs that could indicate the issue is more than just heartburn. For instance, if you're experiencing difficulty swallowing, feeling like food is getting stuck in your throat, or noticing unexplained weight loss, it's crucial to take these symptoms seriously. What can you do? If your heartburn is persistent and doesn't respond to treatment, or if you're noticing any of these additional symptoms, consult your doctor immediately. They may recommend tests like an endoscopy to check for damage or changes in the esophagus. Remember, early detection is key. While persistent heartburn is often manageable, in some cases, it's your body's way of warning you about a serious condition. Don't wait. Seeking medical advice early could make all the difference. Your body has a remarkable way of signaling when something isn't right. Symptoms like persistent pain, unusual rashes, changes in your nails, or night sweats may seem insignificant. But they could be early signs of serious health conditions, including cancer. By listening to your body and taking action early, you can make a life-changing difference. If any of the symptoms we've discussed resonate with you, don't wait. Consult your doctor and take control of your health journey. Early detection is one of the most powerful tools we have against cancer, and it starts with awareness. For more life-saving insights, practical health tips, and empowering information, make sure to explore our other videos. If this video helped you, don't forget to like it, share it with others, and subscribe to Healthy Care. Together we can spread awareness and help more people lead healthier, happier lives. Thank you for being part of this important conversation. Remember, your health is your most valuable asset. Protect it, prioritize it, and live your best life.